So whether we're working a leg or whatever part of the body that we're working and whatnot, we only want to have the area exposed that we are going to be treating. We call that surgical draping technique. So that's what I've done here. I'm doing the surgical draping technique. And on my lap here, normally what I would have across here is I would have a pillow slip or I would have a towel or something like that across my lap, and I would create a barrier between myself and the patient. And that's what we teach. So we're pretty fastidious about the draping technique that we utilize, so that we're really only exposing. And indeed, in our school, most of our teachers, again, have medical credentials and work in hospitals and whatnot, and they tell us that we do a better job of draping than they see in most medical clinics or hospital facilities. So again, we do pay attention to that, and once again, it is called surgical draping technique, meaning that only the area that I'm going to be working on is exposed. Now, again, the next technique that I was going to apply is, first I did the first and second layer soft tissue preparation, and now I do want to go into what's called the deep pocket acupressure.
Okay.
And for the deep pocket acupressure, what I'll do is, once again, in order to push deeply into tissue, once again, I don't want to be pushing through any unnecessary soft tissue tension. So what I want to do is fold the tissue. I want to relax the tissue. I want to put it in a position of neutral. So in order to do that, I can bring his arm up like so, like this here. Okay, just roll on my little stool in here and come in, and then I can work deeply into the muscle tissue. We call that deep pocket acupressure, when we take, our thumbs or our fingers and we work down very, very deeply into the tissue itself. Deep pocket acupressure.
And even though that you're going deep, it's not hurting the patient.
Well,
for the most part.
For the most part, no. This is again medical massage, and there will always be a certain level of discomfort that's involved. But what we want is that we want that discomfort to be a positive experience, or something that is perceived by the client as being positive.
Yeah.
And so it hurts, but it hurts good. So please do more of that.
Okay.
That's the kind of thing that we want to see. But again, by relaxing the muscle tissue, okay, then we can move in very deeply into the tissue. And we can get down into the very deepest levels. Again, we go, eventually we're trying to head towards the periosteum, which is a covering that's on the bone, with our technique, as we move through all the layers of our technique and of our protocol. Okay, now deep tissue to periosteal massage is really one of the next stages or steps that we want to go through with our treatment. And so if I can demonstrate that on the shoulder here, okay, is that what I do is I try to progressively work deeper and deeper through the tissue here. In this area here, I'm on the edge of what's called the deltoid muscle, that lateral shoulder muscle. I have the teres major and teres minor muscles in here. I have the tricep muscle, which comes up and attaches here. And I work through that tissue. And I work deeper and deeper into the tissue. Now, my objective is to go all the way and feel the bone surface. And once I get to the bone, it would be to gently massage against that surface to get the tendinous attachments of the soft tissue, to work the joint capsule, and to work the ligaments that are part of that joint capsule. The ligaments, the tendons, all of the tissue there, we call it a joint complex. And it is our objective to massage that. And once again, if we look at this here, what I'm attempting to do with my hands is to move through these layers of tissue and to work and to massage deep so that I'm getting the tendons, the bone, and the ligaments. And again, we call that deep tissue to the periosteum massage. And in chronic conditions, where people have chronic knee conditions or they have chronic conditions of the shoulder, tennis elbow, what have you, it's often the missing ingredient in treatment is therapy that goes that deep through the tissue. But once again, it has to be comfortable. What we found in terms of scientific research is that if massage treatment is painful and uncomfortable, if the therapist is trying to invasively force their way through tissue, and they might use a knuckle technique or an elbow technique and pushing through the tissue, that stimulates the very same nerves that are the pain nerves that transmit the pain signals. And we don't want to do that. What we want to do is we want to stimulate the receptors in tissue, the sensors in tissue, if you would, that are sending normal signals, that say that the tissue is normal and the range of motion is normal. Those are the sensors that we want to stimulate in terms of our treatment. So once again, by utilizing a soft hand technique, by completely enveloping and surrounding or encapsulating the joint, and then softly working deeper and deeper to the level of the bone. It's an intelligent way in order to apply massage therapy for treatment conditions.
What about fibrosis, treatment for fibrosis?
Well, fibrosis has been recognized for many, many decades as a condition that occurs in soft tissues where they become fibrous and they're just, less pliant and less elastic and more subject to injury. And probably anybody can relate if they've ever eaten a steak or something like that and it's been pretty chewy. That's fibrousness. And so comparing his shoulder to a tough steak, okay, but that would be fibrosis. The word simply means condition of fibrousness. And we do see that. And so what we do is when our hands feel that resistance in tissue, then we do work into that tissue deeply. But once again, we always, no matter where we go, here I'm using an example of using my knee to elevate his arm and his shoulder, plus I still have this rolled towel here, in order to work in along this bone here, which is called the scapula, and it's the same surface right here that I'm working into, right there. And maybe if there was some fibrosis in that tissue, then I would work into that, and I would attempt to soften that. Now, we also use a technique with that that's called laminar groove or groove technique.